Great news for all of you, or I should say all of us, coffee drinkers.
Yeah.
There are two new studies that link coffee to living a longer life. The researchers found that those who drank 2 or 3 cups a day had almost 20% lower chance of death over the 16 years of the study than those who didn't. The study did, however, find why this is the case. So, joining us now to discuss, we welcome our medical contributor. How are you?
I'm excited to talk about
Kasraeian.
this.
I know. First of all, I do have to ask, was this funded by Starbucks and or Dunkin' Donuts?
Hey, get off my Dunkin'.
Well, I just got to make sure, because you know when those studies, they're a little shady.
Yeah. But this is a great topic.
And you know, there's so many coffee drinkers. You know, we hear all this news about, you know, it's good, it's bad, it's good, it's bad. This says it's good. So, explain. Tell us more.
So again, this is a study that actually falls into the place of moderation is actually good. You know, so we come off, you know, several weeks ago we talked about excessive caffeine intake where the young man passed away from it.
Yeah,
that's right.
Where we talk about, you know, the amount of caffeine that you take per day has to be within moderation. And so this kind of falls into point where potentially taking a certain amount of coffee a day and add it to your lifestyle may actually have some benefits. So one study looked at more than 500,000 people in 10 European studies. So actually it's the largest study to date that looked at the association between coffee specifically and mortality, and it found that there was a positive relationship between this, like you mentioned.
So is it the coffee bean or it's the caffeine?
So that's one thing
prolonging life.
They don't quite know. You know, there are a lot of studies that have looked at this, and there's some positive beneficial anti-inflammatory effects, neuroprotective effects with coffee, but they haven't been able to see exactly, and it's not clear what that specific thing. So that's positive room for benefit. They did find that people had better lipid profiles in terms of cholesterol profile. They had better blood sugar levels. They had better inflammation profiles. So all those things can be beneficial in terms of diabetes, heart disease. A lot of times we talk about how inflammation in general has a bad effect, stress. So all those things can be beneficial. Another thing that's really interesting in terms of the criticism or the analysis of this where people are talking is that could it be that people that are drinking this amount of coffee, 2 to 4 cups a day, greater than 3 in the other study, where maybe they're healthier to begin with. You know, sometimes when people are a little bit less healthy, if they have underlying heart issues, maybe we discuss don't drink too much coffee. You know, and so maybe the baseline that you're looking at, some of the people that are drinking a little bit more coffee, maybe at baseline they're a little bit healthier. But this is a large amount of people that they followed in both of these studies. The other one had more than about 185,000 patients who were non-white. So again,
that was my question to you. So it makes a difference. But you know, this brings me back to growing up as a little girl. My mother literally drank an entire pot of coffee every day before she went to work. Every day.
Wow.
Yeah, and that is not what killed her. So that told me, green light, I can drink all the coffee I want. So has things changed? Should I not think that way?
Well, so a pot of coffee is a lot of coffee. So
it's a lot of coffee.
So if you look at it, again, moderation. So, you know, as a urologist, caffeine dehydrates you. It makes your kidneys make more urine. It fills your bladder. It causes you overactive bladder. So if you have those problems, that could be the culprit. As we learned, it can make your heart race faster. It can cause high blood pressure, hypertension issues. So if you're dealing with those issues, it may not be the greatest thing for you to drink a pot of coffee a day. Here they're talking about 2 to 4 cups a day, reasonable cups of coffee a day. We talked about before, you know, 400 milligrams a day, 300 to 400 milligrams a day for an adult, less than 100 for someone who is less than 18 years of age. Those things are things that we have to be mindful. This is a message in moderation. Other things that this talked about, you know, they compared smokers with non-smokers, and they talked about even in smokers they found benefit. As a common sense evaluation of this, it's kind of ridiculous for smokers to take a message here is like, I smoke, and so if I drink coffee, it gives me a 10% reduction in mortality.
Cancels it.
So that's kind of like a ridiculous concept to say that I'm smoking, that increases my risk of mortality from all options. From that standpoint, so if I drink coffee, I negate that. That's not the message here. It shows that if you are a generally healthy person and that you enjoy a few cups of coffee per day, it is this study shows that it may actually be beneficial for you in the long run. It's not one that you go drink a pot of coffee a day and you're going to survive longer and do all these other bad things. That's
and
what
I assume it's not, you know, black coffee, not with like all the sugar and cream.
Absolutely.
Hey.
Oh no, I love
That's what I
what
do.
you do.
When I'm done with my coffee, it's liquid candy.
Yeah,
Well,
that's what I
that's
like.
probably not not the
That's
best
the way
thing
I
to
like
do
it
either.
too.
You know, I mean,
We gotta die with something, Doc.
But listen, we gotta move on to another topic, and it's another topic that is trending this week: a new vaccine that is shown to protect against gonorrhea, and this is a big deal to healthcare officials because of fears the disease is becoming untreatable. So, Dr. Kasraeian, is this the only vaccine of its kind?
So this is a really, really interesting study. So gonorrhea has actually, the World Health Organization is very concerned about this, and it lists it as one of the greatest infection threats to humanity. Because
really?
Yeah, because
Wow.
there are more than 78 million cases of gonorrhea worldwide.
78 million.
Absolutely.
Woo.
Absolutely. In the United States, about 390,000. Between 2014 and 2015, when they were studying this, there was about a 13% increase. So again, the underlying message here is, practice safe sex. Be careful, because a significant percentage of gonorrhea and chlamydia and diseases such as this do not present with symptoms. Up to 80% of women and 15% of men may not have symptoms. So if you're practicing if you're having sex and you're not practicing safe sex, you may not know you're getting this. And these can have, besides the immediate implications of not having symptoms, they can have lifelong issues with ectopic pregnancies, affect fertility, and it exposes you to other STDs like HIV and things like that. But in this particular thing, you're talking about resistant organisms that you can't treat with antibiotics. Here, what they found that this vaccine may potentially decrease the risk of infections by about 31%.
Oh, wow.
What this study found was back in New Zealand in the early 2000s, there was an epidemic of the meningococcal disease. This is the same thing that causes you meningitis, which is an infection, a dangerous bacterial infection of the meninges, which is the membrane around your brain. So it's a very dangerous, almost, and it can be fatal. So it's a dangerous thing. So what they found here is, could we get a vaccine to prevent that? And so they put this vaccine out there. And so in looking at this, they found that the meningitis bacteria and the one that causes gonorrhea are cousins. They're about 85 to 90% similar on the DNA level. So they're like, hey, and then they went back and looked, and they found that when this was put out there, they found a significant drop in the cases of gonorrhea. So they wanted to see if there was an association. So what's an interesting way to study this is that, gonorrhea and chlamydia can sometimes present together, sometimes it can present separately. So if they go and look in STD clinics, they can see if the implications on the rates of chlamydia and gonorrhea change. So they did just that. They looked at chlamydia, they looked at gonorrhea, and they looked at people that had both. And they found that there was a significant decrease in the cases of gonorrhea in people that were vaccinated. And that was profound. And so that's what they found here. There was when you looked at them head-to-head, people that were vaccinated had about a 41% lower incidence of gonorrhea. And all in all, the vaccination that they put in for this meningitis, meningococcal B, translated into about 31% lower incidence of gonorrhea. And so this opens the door for possibly looking at creating vaccines for not just gonorrhea, but this meningococcal bacteria that are out there that are very, very profound and important bacteria, and just opens the door for vaccines. Yeah. Again, vaccines are just an amazing, amazing addition to the world of healthcare and medicine. And as you can see, our resistance that are growing to bacteria are profound, and one of the greatest things we can do is to prevent the infections in the first place.
Yep, absolutely. Preventative medicine. Always the best. All right,
amazing,
cool.
Jumping from coffee to gonorrhea.
Let's all drink our coffee and get vaccinated. I don't know.
Stay safe.
Okay, yes, stay safe. There you go. Thank you so much.
Sure,
Dr.
absolutely.
Kasraeian.
Thank
we
you.
always love having you here in this medical contribution furnished by Kasraeian Urology. You can hear more from Dr. Kasraeian on his weekend radio show, The Conversation, Saturdays on WOKV from 5 to 6. Coming up next, something we all want to do. We want to get the most out of our money, right? Well, we're going to talk with a financial expert about simple steps to take now that will pay off in the future.